Are you feeling dry down under? Yes, I'm using a little bit of Aussie slang today. I've been here 17 years, so I think I'm almost Australian now, although I'm of Indian ethnic origin. So today we'll talk about something called vaginal atrophy. Now, generally, this can happen once a woman hits menopause, but it can happen also to younger women, especially in the postpartum period. So what happens in a vaginal atrophy? So the lining of the vagina becomes very thin because of the lack of estrogen, and because of the lack of estrogen, the glycogen content in the vagina comes down, so the good bacteria cannot grow. So you end up having repeated infections, abnormal vaginal discharge, dry vagina, painful sexual intercourse, or sometimes bleeding during sexual intercourse, recurrent urinary tract infections. So these can be the compendium of all the symptoms that you may experience. Generally, if you are struggling with any of this, please go visit your healthcare professional or visit us at www.athenawomensclinic.com.au to book an appointment. I'm Dr. Kavipriya Soma, a GP with special interest in women's health, and we can talk about this a little bit further. So if you do have the earlier mentioned symptoms, definitely it's important that you get an evaluation done with your own healthcare professional. This will be done generally to assess the local environment. How is the vagina thin? Is it pink? Is it moist? Is it dry? Are there any obvious evidence of infections like abnormal discharge? So swabs may be taken, and if you're not up to date with your cervical screening, then that is also done as a part of the examination. What can you do if there is vaginal dryness? We have different options that we can use to treat the vaginal atrophy. If you're struggling with this particular condition, especially in a postpartum period, sometimes just local lubrication and keeping the vagina moist, sometimes cold packs, they may all be that is needed. If the symptoms are more bothersome than this, sometimes your health practitioner may prescribe local estrogen. There are a variety of estrogens that are available in the market, so please discuss with your own healthcare professional what's going to be suitable for you. Now, the other alternate that is available are minimally invasive treatments. Now, generally, this can be more bothersome in the postmenopausal category, for which these minimally invasive techniques are useful, but this can be used in any woman who is struggling with vulvovaginal atrophy or vaginal atrophy. Now, this particular term, when a woman reaches menopause, it's called genitourinary syndrome of menopause because it encompasses this whole lot of symptoms. So what is the new technologies that is available to treat GSM? Important thing you need to know is laser has been around, but the studies have shown that they're not the ideal treatment because of the local burns that may happen. So the other technology that we have available it's a very old technology that has been available for a long time, but it's been repackaged so that it can be used in the vaginal area. So that would be your radiofrequency treatments, which is helpful in replumping the vaginal mucosa and the submucosal tissue. So that would help with a new collagen formation, neovascularization, as in new blood vessels forming there. So it automatically improves the health of the vaginal mucosa and the submucosal firming and plumping, which will alleviate some of the symptoms that you may be facing. This may be used in conjunction with the medical treatments, or it may be one of the treatments that's most ideal for a woman who has had menopause because of the treatment for like gynecological cancers or breast cancer treatments. So this is definitely an option that is available to you. You don't need to suffer. It is for you to understand and seek help if something like this is what's happening in your life. So if you're planning to fall pregnant, make sure you watch this series of videos so it can help you in preparing for pregnancy. I'm Dr. Kavipriya Soma. If you'd like to talk to us, visit the website www.athenawomensclinic.com.au to book an appointment, or you can watch our videos and take the advice from your own healthcare professional as well. Thank you.